Hi, this is Dr. Bob Dannenhoffer. I'm the Douglas County Public Health Officer, and this is another in our series of Facebook Live events. I'm joined here by lots of great members of the staff, and we'll take your questions for the next hour about what goes on. So, overall, the story with COVID is pretty grim. The number of cases in the world is rapidly increasing, and unfortunately, the United States is now the #1 country in the world for COVID cases. So that is really a sad thing. Cases are increasing very rapidly in the U.S. Thankfully, not in Douglas County, but we're seeing a rapid increases in New York, Florida, and especially in Louisiana. So Louisiana a few weeks ago had Mardi Gras. Lots of people gathering. And if you've ever been in New Orleans, it's pretty amazing the number of people you would touch. So if you remember my little magic marker thing, you touch a lot of people over the space of a night, and then a lot of people would touch you. So there's a lot of mixing that goes on. And now a few weeks later, what we're seeing is really an explosion of cases in Louisiana. And so this shows that it is people-to-people contact that's causing this, and that if we don't practice social distancing, we're going to have all kinds of trouble. So the good news is, I think in Oregon, although the number of cases in Oregon went up a lot today, went up 98 cases in just one day, which is a big increase. We had no new cases today in Douglas County. We're still just at those 4 cases, nobody hospitalized and everybody doing okay. So I think this is a little bit of a calm before the storm, because we could easily get to where it is in Louisiana or where it is in New York, or God forbid, where it is in Italy. So I think we have to be cautious about that. But right now we have a little bit of a calm before the storm. So first, I have incredible thanks to everybody. I was out a little bit today delivering supplies, and I saw that people really are following the social distancing cues. I had to get some supplies at the supermarket, and when I did, people were really very good about standing apart. So thank you everybody for following the recommendations. I think probably most of our questions today are going to be about testing. And if there's anybody frustrated about testing, I'm probably more frustrated than you are. So I actually did the swabs over those first 3 clinics. I actually put these swabs in people's noses, and I told them that we should get the results in 2 to 4 days. And now for our tests that were done on the 17th, it is the 27th, and we still don't have the results from the 17th. Let me explain that a little bit. So the tests on the 17th were done through Quest Laboratories, one of the biggest laboratories in the world. They were done locally, sent to Seattle, and then down to San Juan Capistrano. And something bad happened to all the results from that day. In fact, we're not the only ones to get this. I had a call from the LA Times yesterday that they too have had troubles from tests done on those 4 days. So of the 17 tests we did on those days, we have no results of those tests. The good news is that the tests that we did in the last 2 times, we do have some results on, and thank goodness they're all negative. So for all those screening clinics we've done, they're negative, but still we have lots of tests pending. So we will not have a full picture until we get all of those. Now, this whole testing thing has been frustrating to lots of people, but especially frustrating to me. On our very first call with the state on this in January, we were promised that the testing would be up and ready in January, and then we've heard again and again it's going to be soon and soon and soon. And so now I've stopped believing anybody when they talk about testing. I'll believe it when I see it. But what we have seen is that we have seen lots of negative test results. So although we know the virus is out there, we don't think it's yet widespread, but we'll see. So Lori asks, why is it taking so long? I know one person who was tested 10 days ago and still has not received results. Well, the tests that were done 10 days ago were that group that were sent down to Quest Lab in San Juan Capistrano, and we're still waiting the results. You know, we heard on Tuesday they're going to be back on Tuesday. I heard today they might be back today. Somebody else said they'd be back over the weekend. Unfortunately, they'll be back when they're back. We call every day, several times a day, with top-level people, and we don't have any better advice, and I'm very frustrated. But you know what? I can't be frustrated because it would be hard. So Paulette says, would it help if we just shut everything down for 2 weeks? Would it stop it, or would it just prolong what's going to happen anyway? So the story on this is that unless everybody in the country shut down everything for 2 weeks, that wouldn't be enough. Everybody would have to shut down everything for 6 weeks. And I don't think shutting down everything for 6 weeks is possible. What we're hoping to do is not to get rid of it. It's going to be really hard to get rid of it. There's no place in the world that's gotten rid of it. China, which has done a remarkably good job, and Korea, which has done a remarkably good job, still have some cases, but many fewer. And that's our goal, because the concern is that if we have a lot of cases at once, so if we have more than 1,000 cases in a 4-week period, we will likely have 200 people in the hospital. We don't have a 200-bed hospital, and we would run out of hospital beds, and that would be dangerous. So the goal is we can't stop. What we hope to do is flatten the curve and maybe have as many cases, but have it over a longer period so it doesn't overwhelm the hospital. So Paulette, that's what I've been working on all day with the people from the state about the models for that. Our current models show that if we really do a good job at social distancing, which, as I said, I think people are doing, I think we'll have a bad time, but I don't think we'll overwhelm the hospital. The problem is if we don't do that, if we slack off early, it could rise up and get there. So Lisa asks, is the increase in numbers due to test results coming back? And the answer is that was another argument I had today with the state epidemiologist. Some of the increase is because of test results coming back, but it's not really an increase. It really was a false decrease before. So, for example, in other places that are doing a lot of testing, they're seeing a lot of cases, and they say, well, that's because we have better test results. Well, it's really because the cases were already there. You had terrible test results before. So some of it is, we actually had this big nerdy debate today about what percentage is increased test results and what percent of the increase is due to the natural increase. We couldn't come to it. I think we had to agree that it's some of increased testing and some of increased amount of disease. So someone said, shall we require children to be tested for COVID before they go to childcare? That seems like it makes sense, but it really doesn't. So let me tell you about the test. First of all, the test is pretty invasive, and I will tell you, if a kid gets tested once, they really don't like me anymore, and they don't want to get tested again. And so they would need to get tested many, many times before they went into childcare, and I can't imagine what a horror that would be. The second is the test is only about 2/3 sensitive. So if you got 100 people who had the disease, you knew they had the disease, and you swabbed their nose, maybe 2/3 would test positive. The other third would test negative. So here we're now, 1/3 of the people who actually had the disease would test negative. So if you were relying on the negative test to let kids into daycare, you'd miss it. The other thing is it only tells when you actively have it. So if I had the disease, say I got the disease this weekend, my test today would be negative. So you might test me today and say, well, you're fine to go to daycare tomorrow. And I wouldn't, because I have the disease. So far, far, far better, if we're trying to prevent the disease, is to use screening. And the 3 screenings are you sick today? Cough, sore throat, or fever. The second is to take their temperature if they have a fever. And the third is, have they been around anybody who's had the disease? So if they've been around anybody who's had the disease or a disease like the disease, so maybe the test isn't back or whatever, but they've been around somebody with suspect disease, if they have a fever, if they have one of those symptoms, they should just stay home. And that would go for both the kids and the daycare workers. And when you model that out, that's about 10 times more effective than a weekly test. So we would not recommend weekly tests for both for the pain and the discomfort, as well as it's not very effective. Far more effective, screen for contact with a case. And even if it's not a known case, if mom or dad are sick with a likely case, the kid should stay home. If they're having any symptoms, fever, cough, sore throat, or if they have a fever, they should stay home. So Sue asks, it looks like some new negatives in the county. Where did those tests come from? So we've got a lot of negative tests. Some of those tests are done at the state lab on people who are in the hospital with pneumonia. Some of those are done in clinics, so there's some clinics that are doing a little bit of testing. Some of those negatives come from the clinics, and many of those negatives come from our screening tests. So they say not to take Advil as naproxen, okay. I looked that up today. There was one report from the French health minister that said you shouldn't take non-steroidal anti-inflammatory drugs, which would include both Advil and naproxen, although the rest of the world and the rest of Europe says it doesn't seem to make a difference. This was based on very little data on just a few people. And that's what happens when you have a new disease, right? So you see 5 patients at a time and something seems to happen and people write about it, but that's not thought to be an issue. On the other hand, Tylenol works perfectly fine, and there's been no issues with Tylenol, so it's perfectly fine to take Tylenol. So Crystal asks, why are people who are having trouble breathing and coughing not getting tested? what symptoms are they looking for? Well, we're looking for cough, shortness of breath, and fever. So if they have cough, shortness of breath, and fever, they certainly could get tested at our clinic. And again, we did one today. I think we tested 43 today. So describe the test process and the efficacy of the testing we have now. So I don't think you guys put the video yet of me getting this swab on the website, but there's on the website they'll put up this video of one of our medical assistants actually doing the test on me, and that was done. I did that for training video about a year ago, and you can see it's pretty uncomfortable. So the testing procedure we have now, we use a swab, not this big around, but about this long, and we stick it in the nose about 5 inches, let it sit for 4 seconds, twirl it for 3 seconds, let it sit for another 4 seconds, and then pull it out. So it's 11 seconds in the nose, and people have described it not as painful, but they've described it as distinctly memorable. Nobody will forget having this test. And the question is how efficacious it is. So tests have 2 parameters that we look at. One is the sensitivity. That means if you had 100 people who you knew had the disease, how many would the test pick up? In this case, it's not great. It's only about 2/3 sensitive. And it's only about 2/3 sensitive for a couple of reasons. One is this virus grows really well in your lungs, but not that well in your nose. So if we were able to do a bronchial washing, that is, put a tube down into your lungs and suck out the stuff, that would be very sensitive. But since we're going in the nose, it's not as sensitive. The second is, it seems that on the viral stuff on this, that you don't have very much virus in the first couple of days, and you don't have very much virus after about 12 or 13 or 14 days. So you have to get it in the right time frame, you have to get it in the nose, and you have to have virus there. So for all those reasons, it probably is only about 2/3 sensitive. So that means if you had 100 people, 60 or 70 would be positive, the other 30 would be negative, and those would be called false negatives. It looks for the specific DNA of the virus. So of the people who don't have it, none will test positive. So it's a very, very specific test, meaning that if it's negative, if it's positive, you have it. And so that's a really high specificity. So it's a great test for confirming the disease. It's not a very good test for screening the disease. Now, we hope soon to have a test called a serologic test, which is a blood test, and I saw an ad for it today. Again, I'll believe it when I see it. That test is thought to be very sensitive also, so picks up antibodies very quickly, and so when that comes out, that'll be great. The problem is the antibodies don't develop until you're done with the disease, so it won't really help us to know if you have the disease at the time, but it will certainly help you to know later on if all those people got sick in January and February had this or some other crud. And there's a lot of other crud. So are we treating cases with the same medicines that Korea found to be helpful? Heather asked this question. Well, we don't know as much about Korea. Korea didn't have that many hospitalized cases, but China did. And so we do know exactly the protocols that China used. So interestingly, they did not use antibiotics. They did not use steroids. They used a couple of Chinese herbal medications. They used 5 different medications. And the way they did this is that everybody got treated with 3 of the 5 medications, and then they're going to see if they work. So, for example, one of those is inhaled interferon alpha, which is an anti-inflammatory drug. One was ribavirin, which is an antiviral drug. One was Kaletra, which is an AIDS drug. One was chloroquine, which is a malaria drug. And one was a new anti-flu drug. So they did this, and the results are in on the first one that they looked at, which is Kaletra, and Kaletra did not work, so there's not taking it. Chloroquine, the initial results came out and didn't seem to make a difference, disappointingly, but we'll get more data over the next week. We do not have good data on the new antiviral, the inhaled interferon alpha, or the ribavirin. The news on those is that none of those drugs are available in the U.S. anyway. So the only 2 that they used in the group that are available are the chloroquine and the Kaletra, the 2 drugs that probably aren't going to make a big difference, unfortunately. It would be great to have a drug that worked. Now, there is a report in today's journal, and I read the journals every day. And it talks about the usefulness of acute convalescent serum. So when you have a disease, your body makes antibodies, and it's a little slow on making the antibodies, but boy, after you have a disease, you make so many antibodies. And now you take my plasma after I have a disease and filter it out, you can get really a high level of antibodies. And so that's called convalescent serum. And that seems to work very well. We've been using that for 50 years, and that seemed in these 5 cases in China to work well. So there's a lot of interest in that. Now the problem is you have to have people who are over the disease and well enough to donate blood. We don't have much of that yet, although the Chinese have presumably 60,000 people who are like that. So China may start to use that more. So, we've used convalescent serum for other things. So, for example, if you've ever had like a bad tetanus wound, and you need get something called tetanus immune globulin, or babies who are born who are exposed to hepatitis get hepatitis B immune globulin, those are made in that same way, and they are incredibly effective. So the good news is maybe coronavirus immune globulin will work, but to do that, you have to get a cadre of people who've been through this. Lisa asks, my father is in his 80s and has a doctor appointment next week. Is it safe for him to go to those appointments? Well, we always worry about 80-year-olds going out for anything, and especially going to the doctor's office where there may be sick people. I think most of the clinics in town are now using telemedicine. I was a little skeptical, but I actually did a bunch of telemedicine visits this week. They worked great. We called people on the phone. We did the things that they needed to do, and it really worked great. So unless there's something very specific that your dad needs the doctor to sort of look at, like a rectal exam, which I would hope not, or something that they specifically need to look at, you could do most of these by the phone. So even patients with rashes, they just took a picture and sent them to me, and that wasn't quite as good as being there, but it was pretty darn good. So your father should check with his doctor and see if he can do a telehealth visit. One of the things I've been working on in the last month was to get a freeing up of the telehealth rules. So the telehealth rules used to mean that you had to go to a doctor's office and then connect to another doctor's office to do it. We said, well, that doesn't make sense because we don't want the people going to any doctor's office. So can we do it from home? And I think we got the exemption for us to do it from home, which would be a great way to do it. So Lisa, ask your dad's doctor if he can do it. So the question is, can you detect this disease on a CAT scan, Doug asks? And that is fascinating. So the story is yes. So a CAT scan of the lungs may be the best way to find this disease. It doesn't show up very well on regular x-rays, but it shows up beautifully on CAT scans. It gets what's called a ground glass appearance. And this is something which is a little hard to see on x-ray, but apparently shows up very well on CT scan. So the answer is yes. Other countries are using rapid CT for diagnosis. We're not quite there yet, but we might get there. So when will the antibody test come out? So this is a long line of questions about antibody tests. They promise that they'll be out any week now, and I will believe it when I see it. So does vitamin C help? We do not know much about vitamin C. Vitamin C was not one of the drugs the Chinese tested, and so we don't really know specifically about vitamin C. But we don't think that vitamin C, when you just look at this, vitamin C does not help with other viral infections, so probably not going to help here. Although, vitamin C, perfectly safe ever to take. Vitamin C is in some of my favorite foods like strawberries and oranges, so I don't think there's any harm in eating lots of fresh fruit. So the question Miranda asks, is the disease mutating and causing new symptoms? So viruses always mutate, and actually it's really interesting because mutating viruses can help you go back and do a family tree and find out where these viruses come from. We do think this virus is mutating slowly, not enough to cause a decrease in mortality or morbidity, and not enough to cause other troubles. We good? All right. I'm going to take a little break here. I need to get a cup of water. Yeah, my voice is. I'm still alive. Okay. It was said early on that this was more concerning for the elderly, but now we're seeing new cases in Brooklyn. Brooklyn, you should join us as an epidemiologist. You got great questions. Anyway, I think all over it's caused more problems for the elderly, but certainly not no problems for the younger people. So again, among China, no deaths in people less than 10, and still they don't have any. About 2 in 1,000 for people like 10 to 40. So again, you have a mortality of 2 in 1,000. So if you get 1,000 or 2,000 cases, you're going to get some deaths. And that's what we're seeing. But I still think in the US and in Italy especially, we're seeing a huge death rate among the elderly. And that's why you have this big outbreak in Kirkland, the high death rate in the Veterans Home, and then also the high death rate in this nursing home in New Orleans. So it is early, but why are you seeing younger cases? Younger people also may not have bought into this early on. I saw some disturbing pictures of spring break and people doing all kinds of things on spring break, really young people. You want to prevent this for 2 reasons. One is the low likelihood that you'll get something bad, but really we call this our Mima campaign. So, we all kind of had this thing about our parents, but I think everybody loves their grandparents. And really the reason we don't want young people to get this is to get this and then bring it home to Mima. So this is our Mima campaign that you'll hear a lot more of in the next 2 weeks. So general health of the 4 positive patients. Last we heard, none are hospitalized and all are doing okay. Although what we've seen in people who are positive is this really knocks them for a loop. So people who are sick, especially if they're elderly, it's not like they get over it in their back. A lot of these people are so darn weak that they can't do anything. They can barely just sort of rest in bed. We know of a younger person, a 60-year-old, who had this, and he said, boy, he can go back to work for a couple of weeks. And this is a big, strong, healthy guy. So I think that's it. So the general health of 4 positive patients, not in the hospital and recovering, but, it is a bad disease. So how many results have been returned for the drive-through clinic on the 20th? Did they have the same problem as those on the 17th? Sue asks. If you'll let me look at my phone, I will be able to tell you the exact results because I pulled those up before we talked here. So could you look on that? Becky sent that. Okay, here we go. So on the 17th, we had 17 test results. 13 are still pending, and 4 are negative. On the 20th, we tested 35, and 29 are pending. 29 are negative, 1 is pending, and 5 they were not able to do, and they can't tell us why they were unable to do them. On the ones that were done on the 24th, 43 were done, and they're all still pending. And today they did 39?
43, I thought, but I'm not sure.
Okay, so we don't know how many they did, because they're not all done yet.
45 were registered.
Yeah, so 45. Great. Okay, so as I see this, 134 total, 96 pending, 33 negative, 5 unable to run. So how many results have been, so that was the question. Are the 4 positives all older patients? We're not, so when there's less than 5 people in a group, we don't give that out. But yes, I will tell you, they're all older. So I've heard that people with blood type A are more susceptible to COVID-19 than type O blood. And this is one of the things that's going around. And I looked it up. It's a little hard to know. Blood types differ in different populations. So different ethnic groups, Chinese, Japanese, American Indians, tend to have a different distribution of blood types than white Caucasians. And because of that, it does appear that people with type A are more susceptible because there's actually more type A in China than type O blood. Well, the bad news is you can't change your blood type. So you got what you got. So I don't think there's anything I would worry too much about. So should we worry about working in grocery stores? Should they keep working? Well, the answer is yes, because we need groceries. But the question is, what can we do to make grocery store workers less susceptible? And the story is we could do a couple of things. One is, if the people who are stocking the stores, you don't need to go up and give them a big hug this week. When we're over this, please go ahead and do that. And should they keep working? I was in the store today and they had a splash shield up. That will decrease it. And certainly we would say is people who are sick should not go to the grocery store, because people who are sick may be coughing or whatever else. They shouldn't go to the grocery store because they get them sick. So if you're sick and you need somebody to get your groceries, I would have people go to recovers.org, where people can get somebody else to do their grocery shopping. Because please, 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 the worst thing would be to grocery store and then make the poor clerk sick. So if CTs are effective for finding it, why aren't we using them for faster results? Red asks. This is a tough question. I've been supporting this for 2 or 3 weeks. It's hard to get people to listen because it is very effective, right? Because doing the swabs takes a swab, which are in short supply. Doing the swabs takes a couple of days, and the test is only 2/3 sensitive. CT scans are 98% effective. They're done in 2 minutes, and you can get the results in 10 minutes. So I don't know why we're not using more of them, but I don't have a CT scanner, so I can't do it. So is there a plan for when this gets really bad, like setting up a temporary hospital? Tabitha asks. You guys are great. The answer is yes, and I spent about 2 hours today getting that ready. So yeah, there are plans for what happens if the hospital gets overloaded. I think what you've seen is some of these temporary hospitals set up in convention centers or whatever. That is not a particularly good choice. I mean, who would want to live on a convention center? I think we have much better plans coming. You'll have to give me a little bit of time, though, before we reveal details, because obviously that could make it hard for us to do the things we need to do. So can we get this through contact with packages, Jamie asks. And the answer is theoretically yes. So this stuff can live on cardboard and whatever, but practically not really. So, people who are worried about this, I have the great plan. So you buy a pair of rubber gloves like you would use to wash the dishes. When the package comes in, you undo the package with your rubber gloves, throw away the packaging material, then wash the rubber gloves with some bleach solution, and then your risk is going to be 0. Now, for me, we got a package today, I just opened it. So do we have any idea where the people were positive where they got it from? The answer is no. We've done a very extensive thing. And although we went all the places, we cannot find an intersecting place where they got this. And this suggests to those of us who do epidemiology that there are probably a bunch of people in town who have it, and they got it from them. And the people they got it from may not have been particularly sick. So we do not have any idea where they got it from. And they don't have any, and again, we've tracked down all of their contacts, and all of their contacts have been contacted. So if you've gotten contacted, please follow our advice exactly. And if you haven't gotten contacted, you weren't a close contact. So the question, if you get this once, can you get it again? Amy asks. The answer is we think not. Other coronaviruses you just get once, although your immunity may not last forever. So there are certain diseases like norovirus, which you can get multiple times, usually not within the same couple of months, but others you get lifetime immunity to, like from measles. We don't know where this one fits in, probably somewhere in between. So probably if you get it once, you're not going to get it at least in the same season. So Kelly asks, are the 4 people in the county who have this recovering? And they are. Slowly, though, because I think this is really important. So is bar soap effective for washing hands? Gabriel asks. Absolutely. And I went to the store today. There's plenty of bar soap. So you could wash your hands until they fall off with all the bar soap that's out there. So it seems that OHSU is testing all of their staff. I think that is not, Sylvia S., that is not true as best we can tell. They are testing all of their staff who are ill. They're not testing all of their staff, as I understand. And so, Sylvia, if you know the details of their testing all of their staff, because we know how many tests are done in the day, and if they tested all their staff, they have more staff than all the tests that have been done in Oregon, so I don't think that's true. But I think they're testing all of their sick workers, and we are recommending that any sick healthcare workers get tested. We tested half a dozen or so today at our clinic. How at risk are children? Heather asks. Well, we think our children are at risk for the disease, for getting the disease just as much as anybody else. There's no sense that children don't get the disease. What children don't get is they don't get the severe ARDS and death. So the concern on this is kids could have this, spread this around, not be particularly sick, but make other people like Mima really sick. So we have to protect against that. So thank you for doing this. Nice place to get real information. This is real information. So why won't you tell us what stores the positive case here went to? I'm worried that I will catch it. I think you have to assume that every store you went to, everybody has it. So you remember back in the time of HIV. So I trained before HIV was prevalent. And we, at that time, we drew blood, not wearing gloves. We had blood all over the place because we assumed that we would know who was sick with hepatitis or whatever, and we would only use precautions on the people who we thought had disease. Well, AIDS made it very clear that you couldn't tell who had it and who didn't, and we went then to universal precautions. So anybody who is younger than I would be horrified to think of somebody doing a procedure covered in blood without wearing gloves, but that was actually the norm back in the 1970s when I trained, and so they did it. So I think now what we have to assume while this is out there, we have to use universal respiratory precautions. Like everybody who's at the store could have it, which means that for everybody at the store, you should socially distance, and everybody should cover their cough. And if somebody's coughing, you should stay away from them. So I think that's the best approach right now. I think, knowing what store or what somebody was in, if I said they were in X store or Y store, how would that really help? Because with the number of people we think have it, you have to assume that every store has had somebody in it who's had the disease. So again, the 4 patients are in the hospital. They are not currently in the hospital. Do you think April 28th is too soon to open schools? Some schools are closing altogether, Crystal asks. I don't know. We'll know a lot better by April 15th, and we have then time to know. There are multiple projections about what this disease is going to do. And again, I spent most of my afternoon arguing with other like-minded nerds about what the best estimate is. The best estimate is this is going to continue to grow for another 4 or 5 incubation periods, which is 20 days. So we'll see what happens. I think we're going to reevaluate. I don't know what's going to happen. I mean, it's really hard to predict. I don't know what's going to happen by the 28th. I don't think the 28th is too late to open schools. I don't think anybody thinks that it's too late. Will we still have May and June? I don't know. We'll let you know. We're going to be doing this twice a week, so who knows, Matt. So can you have flu and corona at the same time? Well, this is really, really interesting because one of the initial things said, well, if you had flu, if you were positive for flu, we wouldn't do a corona test. So we have very few corona tests on people who tested positive for flu. So the question is, could you get them at the same time? I don't know. There was one study that came out today that said maybe 20% of the people who had corona also had flu at the same time. So we're not going to know. The way we're going to know this is when the antibody test comes out. Somebody says, well, they diagnosed me with the flu, but I think I also had corona. If they have the antibodies there, they did. So how long should people stay quarantined after recovering from an illness? So if you really want to be careful, we say that 3 days, 72 hours after all your symptoms are resolved. So I've talked to a few people. So the phone call goes like this. Like, I'm pretty much better from this. I want to go back to work in the nursing home tomorrow. And my answer is, look, you've coughed 3 times in the 10 seconds I've been talking to you. Your cough isn't better. You really need to wait until all your symptoms are gone for a couple reasons. One is you may still be contagious. The other is I don't want to be taken care of in a nursing home or anywhere by people who are coughing. So Lisa asked, does Douglas County have enough masks and ventilators? Well, Douglas County has a lot of masks and a lot of ventilators. And so if we don't get overwhelmed in the hospital, we don't get like 1,000 cases in a month, we will have enough masks and ventilators. At the current usage rate, I think we have at least 50 days worth of masks. And if we don't have a lot of cases, we have plenty of ventilators. And so the key is not to bunch up 1,000 cases in a month. If we have 100 cases a month, which is a lot, we expect 20 of those to be hospitalized, maybe 5 to be on ventilators. We have plenty to handle that. We have 1,000 cases. That means we'll have 200 hospital admissions and 50 ventilators. That will be right where we're starting to cry uncle. If we had 3,000 cases in a month, that would be 600 admissions and 150 ventilators. I do that in my head. And 150 ventilators, we don't have that. So the goal is to slow this thing down so that we never have more than 100 cases a month. Right now, one of the troubles with masks is most of the masks were made in China. And so starting in mid-January, we didn't get any more resupplies of masks. So most hospitals, like most places, have, a few weeks worth in supply and they order new in. But since nobody has gotten resupplied since mid-January, we're beginning to run out of masks. Now, there is a state stockpile and a federal stockpile, but they have almost no masks left. So we're not getting a lot there. So we think if we can keep this in control, we're okay. The problem is that we have a big surge of cases. So will COVID-19 cycle through families like the flu? Yes. So at least the data in China is such. That it sort of cycled through families. What was interesting about this, though, in some families, is that there would be a family of 5 or 6 and one wouldn't seem to get it at all. When the serologic tests come back, it'll be interesting to know if they really did get it or if they got it but were not very symptomatic. And should we get a flu vaccine? This year, the flu is pretty much gone. So by the end of March, it's pretty much gone, and we're there by the end of this week. So, but next year, absolutely, positively, without a doubt, get a flu vaccine. So is there a timeline for all of this to be over? So the timeline for all this to be over is when we get an effective vaccine. So once we get an effective vaccine, we're going to do a drive-through COVID virus clinic. We'll run it many hours a day as we need to get everybody the vaccine. And if we have a reasonably effective vaccine that covers at least 60 or 70% of the people, this truly will be all over. But until we have that, our hope is to do what they've done in Korea, which is to get kind of over this, still have some cases. So China, for example, has about 100 new cases a day, but in a population of 1 billion, 100 new cases is totally manageable, and they do it like that. So we have a lot of diseases what we haven't gotten rid of. You've never even heard of. There's one called metapneumovirus, which is sort of like this. It's not very contagious, but we get cases all the time of metapneumovirus, and occasionally people die of metapneumovirus, but you haven't heard of it very much because it's not very contagious. So in this one, if we can get it mostly away, attack new cases when they get there, we can bring this down to a time where it's sort of an annoying, but not nearly so serious. The concern is if we have 1,000 cases a month in Douglas County, it is going to totally stress out the system. So if you test positive, does that change the treatment recommendations? No. The treatment is exactly the same whether you're positive or negative. It's all supportive, because remember, there's no proven treatments. It's all supportive, so it doesn't change treatment. What it does change is it changes what we in public health now know about what the disease looks like. So there are a lot of people going to the hospital having pneumonia, and you don't know what causes pneumonia. But if we're able now to say, that was a COVID pneumonia, that was a COVID pneumonia, it helps us to figure out what's going on. It also helps because when people have COVID, it's a weird disease. If you think of a disease like pneumococcal pneumonia, somebody gets sick for a day or two and then they come in the hospital, they are darn sick, high fever, bad looking x-ray, they are sick as a dog, and then they get better over time. This one is different. Most people in the first week are sick, but not that sick, and they start really getting sick on the 8th and 9th day. So if you were able to do rapid COVID testing and know that, you would be able to know the ones who you really needed to be worried about for getting worse. So how long does it take a vaccine to test to be sure that it's effective and doesn't cause other issues, Tabitha asks. Well, this is complicated. So as I've said before, when vaccines are made for an existing group of things, so like HPV, they start off with a few and then they went to new strains. Influenza they make new ones every year for the new flu vaccine. Those don't take very long. So, for example, in 2009, when we had the swine flu, it was a flu. It only took about 2 or 3 months to develop, test, and distribute the vaccine. So that was very quick. Coronavirus is in a new family of viruses. We've never made an effective vaccine against any coronavirus, so we don't really know. I think Dr. Fauci, who I believe on this, says it's going to take 12 to 18 months. However, you'll remember that we've been trying for 40 years now to make a HIV vaccine, and it hasn't worked. So we're hoping that this is going to be good. So should we still see therapists in the office? So doctors' offices can still be open. Again, seeing a massage therapist or something, you have relatively close contact. I think if you can leave it off or delay it, that would be great. Some of these are going to be important because some people really rely on their therapists. for their health. So I let you make a decision. Again, if you can do it if this is a behavioral therapist or a psychologist, you could probably do this by phone. Obviously, a massage therapist, you can't call that one in. So does the pneumonia vaccine help to lessen pneumonia from COVID? Now, this is very interesting because with influenza, it's not uncommon for people to get influenza and the next week to get pneumococcal pneumonia, in which case the pneumonia vaccine, which helps prevent pneumococcal pneumonia, would work. At least in the Chinese and the Korean literature, there is not a lot of secondary bacterial pneumonia after COVID. It's a different kind of disease, so there doesn't seem to be a lot. So certainly I would recommend you get a pneumococcal vaccine, but there's not a lot to suggest that it's going to help with COVID. So am I getting enough rest? You are working around the clock. And the answer is not. The answer is I get rest every single night. It's so important to go ahead and do that. So I've been exercising. I've been cooking every night. I've been getting at least a couple of, my normal amount of sleep, which is usually between 6 and 7 hours. So, and I encourage everybody to do the same thing. I mean, really, this is not going to be a sprint. This is not going to be a week or two. This is going to be months or more until we get this. So people really need to take care of themselves. And especially if you're sort of like staying at home like the governor says, please treat yourself, get extra sleep, binge watch, eat ice cream. It'll be great. So Heather asks, is Douglas County the large threat like that report said? So if people listen to National Public Radio, I did talk about that. So this report looked at a couple of things. So it looked at the age of people in Douglas County. It looked at the poverty in Douglas County. It looked at the number of people who drive. I don't know why that was important. And then one of these reports also looked at the number of hospital beds. I think that report was well, not even interesting, but, not surprising we have a lot of old people, not surprising that we have more poverty in Douglas County than other counties. And because we don't have a tertiary care hospital, we've got a great hospital here, but for example, they send out neonatal ICU patients, right? You have to regionalize that service because not every place can have a neonatal ICU. So we send a bunch of babies there and a bunch of moms there because they have a specialized unit at Sacred Heart. As a pediatrician, they have a pediatric surgeon there. We don't have nearly enough business for a pediatric surgeon in Roseburg, but in Eugene, because they get everybody from Roseburg and the coast and Salem, they do. So we send a lot of patients there. So we have a relatively low number of hospital beds in Douglas County. When you put those together and have nothing else to do, and you make this ranking where these rankings drive me crazy all the time. It's like the best place to live, the worst place to eat. I think it's people with too much time on their hands. But they said Douglas County was a bad place to be. And statistically, it was like, no duh, we've got older people, no duh, we've got poor people, and no duh, we don't have a lot of hospital beds. And what I said to the person from National Public Radio is, how does that help me? It's not like I can change the age of the people here. If you will give me money so I can make people less poor, please do it. And, hospital beds are slow to build. So none of these were particularly helpful. And you know which county was the best county to live in? It was Westchester, New York. So it was one of the best counties to live in. It's rich. They don't have very many old people. They get a lot of hospital beds. They also have 40,000 cases in New York. So as I said to the person on PR, would you really rather live in Westchester? I don't think so. So the story is we are going to struggle here a little bit. We do have older people. And because we do have older people, we have to be especially careful to work on social distancing. So how severe could this be for somebody with asthma? What about smokers? We certainly do know that smokers had a worse time with this. Interestingly, the data does not suggest that asthma is a big risk factor because it affects different part of the lungs. So the asthma really affects the large airways. So, is on the top part of the airways. This affects way down deep where the ACE2 receptors are. So actually asthma was not a risk factor. So is my child more at risk with epilepsy? Again, epilepsy was looped into the big group of other neurologic disorders that did do it. I think if the epilepsy is reasonably well controlled, I don't think this would be a big risk. Again, there are a lot of kids in China with epilepsy, and they were 0 deaths. So what if people don't have a fever, but the rest of the symptoms, should they still be tested? Well, about 91% of the people who've been tested positive had fever. So if you don't have fever, your likelihood of being positive is much lower, but still not zero. So we would test people who had all of the symptoms but no fever if they were in a high-risk group, maybe if they were really old, because old people don't make a lot of fever, or if they were a healthcare worker and we didn't want them to give it to their patients, or a caregiver in a nursing home. So that's a nuanced question. So when should we expect the vaccine? Sue asks, well, certainly not going to get it soon, not going to get it in the next month or two. The best hope we would say is that we'll find the right antigen for this, and then we'll find a vaccine that works as an effective, and then we'll get this vaccine in the next year or so. I would hope that once we figure out what the right vaccine is, that we put every effort in this country into manufacturing it. The manufacturing thing should go really, really, really fast. I will be so disappointed if they make it in one tiny little factory somewhere. We really should put every effort to making this. Do you think we really be shut down for months? Margie asked. I don't know. I think we're going to be certainly shut down till the end of April. There was talk today about finding high and low risk counties or areas and then letting low risk places go back. I think there's a chance that after April, if the social distancing stuff works well, we can go ahead and figure out a way to get people working again a little bit better. So, I know a lot of things are closed down now, but, you could maybe open some more stores. You might be able to open restaurants if you allowed social distancing. So somebody asked me this question the other day. They work at Red Robin. And the story is like, oh, this really stinks because, we're losing work. Is there a way that these restaurants could open? Well, when you're at Red Robin, you sit there and, this next person is just a few inches away. You might be able to do it where family units who are already exposed to each other could be in the restaurant and be 6 feet apart. And that would still work. Could you go to the theater? Well, if you made it so that you closed off two of every 3 rows and had people sit 5 seats apart, you would have some social distancing there. So I think we could maybe come back in a limited way. I really don't think we're going to have like Blazer games again in the next few months. But again, summertime, there's a hope that and the weather gets warm, maybe we'll get down. And so we'll see. So Renee asked, do you think we're any closer to a treatment or a vaccine? We're clearly closer than we were a week ago and clearly closer than we were 2 weeks ago. It's hard to predict what the treatment is going to be and what the vaccine is going to be. Again, I think we're, a year to 18 months from a vaccine at the best. And for a treatment, something could come up. It's so amazing on treatments. You try. People may think it's like, oh, scientists in the lab come up with this and they know it's going to work. The answer is it almost never works that way. So the way they figured out penicillin is bacteria in the lab, and what happened was the mold that was around, some penicillin mold, got in there, and the guy said, it's interesting. There's that little mold spot on there, but no bacteria grow around that. And he then recognized that, maybe this is interesting. And then he figured out that if you grew penicillin mold, the bacteria would grow about it. Let's do penicillin. So it was kind of serendipitous, and I think with this, we're likely also to find something that's serendipitous. So something that we don't think should work might work, and then we'll figure it out. So Tabitha asked, what are the symptoms? So here's the typical story. And what I've collected is a bunch of vignettes, so stories about what people had. So let me go through the story, which would be a typical vignette. I felt fine on Tuesday. On Wednesday, I started to feel achy, and I had a little bit of a dry cough, and I felt like I had fever, but I took my temperature and it was normal, or maybe it was like 99.6, so a little higher. The next day, I felt like I got run over by a bus, and now I started to have a lot of cough. On Friday, the cough got worse, and now I started to have some heaviness in the chest. Over the weekend, I started now to have real fever. The heaviness in the chest increased. And so now on Monday, I'm really feeling sick. I've got this terrible cough, feels like somebody's sitting on my chest. And then what happens is some people get worse and they wind up in the hospital. Most people get better and wind up just coughing for a few weeks. So that kind of slow onset is very different from the flu, right? Flu, you remember to the hour when it started, and you start with fever in that first hour. This one, the fever is kind of a little slow to come up and whatever. Now, the problem is these symptoms look like all kinds of other crap that I see in the office every day, way before COVID was around, so you can't tell. So is there a worry about mosquitoes spreading this, Dee Dee asks. And I think the answer is no. There has been no evidence there's been any blood transmission, and that's how mosquitoes do it. So a bloodborne disease like malaria, or a bloodborne disease like Lyme disease, or a bloodborne disease like West Nile virus, clearly bloodborne, clearly got to worry about mosquitoes. No sense that this is bloodborne. So, Sandy asks, I'm a healthcare worker but don't have a fever. Well, the question is, do you have anything else, right? If you have a bad cough and whatever, you should talk to your doctor. Should I go to the drive-up testing and I have some symptoms? So talk with your doctor. We've asked the doctors to do the evaluations. They know you a whole lot better than I do, and they can tell you if you're a candidate. If you're a candidate, I think we're probably going to have another testing site on Tuesday, and if you're a candidate, we'll get it done. And Karana asks, how are we helping the homeless? And I've answered this question, I think, each time, and it is a really important question. The homeless are at really a higher risk. You know, if you think of what we're telling people to do, stay home, wash your hands, have clean surfaces, don't congregate. Many of the homeless people in our community do have those risk factors. In addition, many of the homeless people congregate to stay warm or to share food, and a lot of the homeless in our community have underlying health conditions that make them at higher risk, and many smoke, all that make them at higher risk. So we are terribly worried about the homeless. We do not have a good solution. Again, I was working today on a solution that might help, but we're not there yet. So is anyone preparing data that can help us predict future trends? And again, that was most of my afternoon. We have some very elegant models. If you go to the Oregonian today, you can see a model that was there. I think that one undercounts the number of cases, but that there's a model there. The New York Times, if you can get on the website, has a very elegant model of what happens. There's the Dr. Bob model. I don't know if it's any better than anything else. I'm not very good at predicting sports, so I'm not sure I'm very good at predicting outbreaks either. So can dogs pass the virus from one person to another, Kayla asks? We don't know. We think dogs may actually have the virus, may actually get tested positive for the virus, but we don't think they necessarily carry it. So, there are viruses everywhere. Thousands, millions of viruses out there. And so animals and people have lots of viruses, but unless that virus actually propagates in your system and makes more virus, it doesn't really cause a lot of trouble. So we don't think that animals, however, the recommendation is that if you're sick with this, that you stay away from your pets, which for some people could be a real issue. So are people with heart disease and diabetes more at risk? Absolutely. So both heart disease and diabetes independently were at risk, because heart disease and diabetes tend to happen in older people. That's another risk. So people with heart disease and diabetes clearly more at risk. So really, truly, if you've got those things, please, please, please take care of yourself. So can you explain the difference between allergies and COVID-19 symptoms? Kayla asks. And this is an interesting one, because this is the time of the year when we're starting to see more allergies. So starting about Easter time, we start seeing an increase in trees. We started to see an increase in tree pollen now. So for people who are sensitive to tree pollen, they may be having allergy symptoms. So let me try and separate them. So allergies, the typical allergy thing, and I'm allergic to grasses. So every June when I drive up into the valley, I get stuffy nose, I get a lot of sneezing, I get red, itchy eyes, and I get better with an antihistamine. With COVID, you get very little runny nose, very little sneezing, and a fever, and it doesn't get better with antihistamine. So I think you could try and separate the two. On the other hand, nasal nastiness is a little hard to separate. But COVID, much more likely to have fever than allergies. Clear runny nose, much more likely in allergies than COVID. Getting better with an antihistamine, far more likely with allergies than with COVID. But not always easy to tell apart at a distance. Okay, we have time we don't have any more questions. Okay, so let me give you a couple things. We're going to do this again probably Monday night. I'm also going to be on KQEN on Talking Health at 4 o'clock. A couple of things I have people do. One is if you have questions in the interval, send them to us and we'll gather them for the next time. Other things, the hotline. Our hotline is still going. What's interesting on the hotline is we've answered a lot of questions, over 600 questions now, and the call volume is actually decreasing at a time when the worry in the country is increasing, and we hope that means we've answered everybody's questions. So we'll see how we're going there. We may actually pull back a little bit on hours because we are not getting a lot of calls in the evening, but that's still going great. If you want to volunteer, we're always looking for volunteers, especially for the call screeners. And we'll see. And the hotline number is, I'm told, 541-464-6550. That's 541-464-6550. Brian tells me I need to have a more like car salesman voice. So 541-464-6550. And then recovers.org is the website we're using if you have something you can do for somebody else or if you have a need that somebody else could do for you. So for example, this person who's with diabetes and heart disease, boy, it would be great if you didn't leave your house. So if you wrote in there, I need somebody to go grocery shopping for me, and then somebody says, I'd go grocery shopping for you. Actually, bizarrely enough, one of my favorite things to do is grocery shopping. So if you said that, I might even do your grocery shopping because, staying at home would be great. So recovers.org, when you get on there, you have to do recovers.org and then it says pick a city and you pick Roseburg or Douglas County, you'll get there. The other thing is a screening clinic next week. If you think you want to get tested, talk with your doctor and your doctor knows how to go ahead and do it. And again, the results of the tests, so frustrated. We post these every time they change on our website. So anytime there's a positive increase, we will post this on our website quickly. And so you'll know the exact number of cases. The negatives we post once a day so that if we start to get more negatives from these screening clinics, they'll be on there once a day. And anytime that there's a positive case, we will have a press release that we do jointly with the county. And once a day, we'll do a press release that will also talk about the negatives. So we want to keep you informed. We're really not hiding anything. And if anybody could help us get these tests done sooner, that would be great, but I don't think that's possible. Again, this is Dr. Bob Dannenhoffer, Public Health Officer, doing our Facebook Live. See you again next Monday. Bye-bye.